this field?
Okay, so my name's Kirsten Lastra. I am an RN, obviously. I have my master's as well in nurse as a nurse practitioner. I recently took over as nurse manager of a surgical intermediate care step-down unit. But before that, was 4 years of experience as a bedside nurse on the surgical step-down unit, and then I went for 4 years into our surgical intensive care unit. So this is a new managerial role. I guess not that new because it's been a couple months now, but now I'm the nurse manager of the step-down unit.
Great. So in this interview, we are speaking about cultural competence. What are some of the benefits and challenges you have personally experienced working in diverse environments?
So I think it's changed now that I'm a manager because I see a lot of different patients and their families, and every day I round on the whole unit and I speak with patients' families, help them make different decisions about their care. I answer their questions, or I'm getting other people involved to make sure they feel comfortable with the decisions they're making. So I think that it's always important to remember that everybody has a different background. Everybody comes from a different cultural, upbringing, and it's important to remember that some things that may be, are not so important to me are important to other people. So it's important to be open-minded when you're talking with these families, and listen is so important, to listen to them and what their needs are, because everybody's different. So I think it's really important to you have the patient and their family, and everybody's different. So you have to, address each patient and their family differently. And you have to just keep an open mind about what's important to them and listen and say, if it's important for them to have a family meeting every day, then we do that. Or if it's important to, make sure that the brother who might be thousands of miles away is on the phone every day and I'm giving him an update, then that's important. Or maybe they want to bring in a certain type of food that their family member likes because, it's the only thing that they'll eat right now. So it's just important that if there's those things that that they identify as important to them, then we make sure to include that.
Thank you. Can you talk about a time you had to advocate for a client based upon the diversity needs?
Sure. I know that with, everybody's different, and like I was just saying, that I have to address the family and keep an open mind and listen to what their needs are. And, in the Asian culture, you learn that they don't always make eye contact, especially if it's a male and I'm a female. So it's just important to identify and clarify what's important to them about who is involved in the conversation. And, if they're not comfortable speaking with me, it's getting somebody else involved. And I think for them, I identified with this family that the most important way to deliver information and have them an open discussion was to make sure that we had a family meeting, every day, every other day, that had, the primary family member, the physician, the bedside nurse, our social worker, and then myself, just to all be on the same page and all coming at them with the same information. So, like I said, you just have to listen, because there are things that are important to people that may not be important to yourself, but you have to be respectful and culturally competent to make, sure that, you address their needs, and we're not being judgmental, and we're accepting everybody for, what's important to them.
Great. Thank you. And one last question. What advice would you give to newer professionals who are trying to become culturally competent in their field?
So I definitely think that it's important to read about it. It's easy to say, oh, you have to be culturally competent, and people say it just means you have to accept cultures, which isn't the case. You may not agree with some things that other cultures, is a big focus for them. It just means that you have to be respectful. Doesn't mean you have to accept it for your own belief, but it just means you have to be respectful, that that's something that's important to those people. So I'm going to be respectful, and obviously making sure that the patient is safe and that it's something that is acceptable for the patient at that time. But it's just, being respectful that everybody has things that are important to them, and we have to be mindful that it might be something that'll benefit the patient, even if it's bringing in their favorite food from home, or having their favorite blanket or something like that, or having time for prayer. Everybody has different needs, and it's important to just listen and be mindful that it might be something that it's not something that I do, but I, respect and I accept that might be something that will help them heal and get through the process. So it's just important to be open-minded, I'd say, for people who are looking to be culturally competent, to be open-minded and know that you don't have to accept everything that you see, but just to be respectful of other people's, wishes.
Well, thank you so much for your time.
You're welcome.
And, and thank you for your information.
Sure.